Hey everyone, it's Vesoverse, where we dissect medical jargon into simpler topics. Today, we're going to talk about semi-synthetic penicillins. In the previous video, we talked about natural penicillins, including penicillin G and penicillin V, where G is given in the IV or intramuscular forms, and for V, we give it orally. So apart from this, we have semi-synthetic penicillins, and these include many antibiotics, including one, the Penicillinase-sensitive aminopenicillins. So we have the aminopenicillin family, we have the Penicillinase-resistant penicillins, and then lastly, we have the anti-pseudomonal penicillins. So this is the outline of our lecture for today. We're going to talk about all of these, including their families, their spectrum, and clinical uses, and by the end of this lecture, we're gonna solve some clinical cases and practice questions together. So let's dive in. All right, guys, so before we dive into this video, I wanted to tell you about a really interesting thing that we offer. If you go to our website, vesoverse.org, you can get our sketches like this for free. So just go to Sketch Library and then go to the topic that you want. Let's say we're discussing antibiotics. You would just go to penicillin illustrations, for instance, and just get a sketch, and then you can just easily download it. First, we're going to start off with Penicillinase-sensitive penicillins. These include Amoxicillin and Ampicillin. And an easy way to remember that the oral is Amoxicillin, we have an O here. So Amoxicillin is given orally, and Ampicillin is given IV. The reason we call these aminopenicillins is that if we look at the structure of this beta-lactam penicillin, we find that in the side chain we have an amino group, and that's simply why we call them aminopenicillins. Now, an important thing to keep in mind is that they are sensitive, and the reason is we have a beta-lactamase, which is a bacterial enzyme, that it would just come and cut the string, rendering this antibiotic useless. The mechanism of these penicillins is as follows. They come and they have great penetration through the porins. So it goes to the bacteria. We've said that especially gram-negative bacteria have porins. So it goes and it penetrates easily, easier than the natural penicillin through these pores, making its way through the bacteria to kill it. So they have a wide spectrum. And we can remember this with the HEELPSS mnemonic. So the HEELPSS mnemonic stands for Haemophilus influenza, Helicobacter pylori, E. coli, Enterococci, Listeria, Proteus, Salmonella, and Shigella. Therefore, the clinical uses include sinusitis, otitis media, as well as meningitis. And when we're talking about meningitis in this case, we're mostly talking about Listeria. Listeria is a gram-positive rod that affects mostly the elderly, the immunocompromised in general, as well as children less than the age of 5. So pediatrics, geriatrics, and immunocompromised. And another important group that we can add to these risk population are pregnant women. Let's look at the important side effects of these penicillins. We have discussed these in more details in our previous video about penicillin, but the really important side effects that you have to keep in mind regarding aminopenicillins includes maculopapular rash, Stevens-Johnson syndrome, and the more severe form of this syndrome, which is toxic epidermal necrolysis. Now, an important thing to keep in mind is that this maculopapular rash typically happens when we have an EBV pharyngitis. So this EBV pharyngitis is frequently confused with strep throat, and therefore we give penicillins. And because of that, the patients would develop maculopapular rash. They would present with a rash 1 to 2 days after they take the medication or the antibiotic in this case, but this is isolated rash. We don't have any systemic manifestations like fever. In this case, we have to suspect that it's actually a pharyngitis, it's a viral infection that we have confused with a strep throat, and we have to adjust the treatment accordingly. And examples for commercial drugs including Augmentin and Unison, Amoxicillin clavulanic acid, and Ampicillin and sulbactam. Let's move to the next antibiotic category, which is Penicillinase-resistant penicillins. So these antibiotics, we have Oxacillin, Nafcillin, and Ticarcillin. They cover Staph aureus and most strep bacteria. So the Staph aureus it covers is non-methicillin resistant Staph aureus. And as you can notice here, we have Staph aureus and strep. Both of these are normal skin flora, and therefore we use these antibiotics to treat skin infections, including community-acquired cellulitis, as you can see on the screen here, and Impetigo. An important thing to remember is that they are resistant and they have a narrow spectrum, unlike the ones that are sensitive. And what really makes them resistant is their bulky side chain. It's so bulky that it protects the beta-lactam ring. One more thing to keep in mind, which is important for the boards and the wards, is that mostly when we have staph, we use Naf. So Naf for staph, this is an important point to remember. Lastly, we're going to talk about anti-pseudomonal penicillins. These include Ticarcillin and Piperacillin, and they have greater channel penetration. Greater porin channel penetration is compared to aminopenicillins that we've discussed earlier. So what they do is that they again penetrate through the bacterial porins. However, an important downside here is that they are susceptible to beta-lactamases. And to prevent this, just like we prevented that in the sensitive ones, we can use clavulanate and tazobactam. The commercial names for these include Augmentin and Zosyn. So these anti-pseudomonal antibiotics are really preserved to these very severely ill patients. And they're typically, you find them in the ICU, the patients with sepsis, and patients with pneumonia, especially with exacerbations like COPD, chronic obstructive pulmonary disease. So with that, we conclude our lecture for today. Next, let's go with practice questions. All right, my friends. So case 1 says that we have a 25-year-old pregnant woman presents with fever, headache, and nuclear rigidity. CSF analysis or cerebrospinal fluid analysis shows lymphocytic pleocystosis with positive gram stain for gram-positive rods. So here we have a gram-positive rod. Which of the following is the most appropriate antibiotic to give for this patient? Because before we proceed and give an antibiotic, let's understand what this patient has. The patient has fever, headache, and nuclear rigidity. This makes me think of meningitis. And what are the most common causes of meningitis? The most common cause, number 1 cause, is strep pneumonia. Other causes that are really common include Haemophilus influenza, as well as Neisseria meningitis. So, in this situation, meningitis, in this situation, the only gram-positive bacteria here is strep pneumonia. But let's further look at the case. The patient is pregnant, and that's a risk factor for a listeria infection, right? So now I'm thinking about listeria. And if we remember the HEELP mnemonic, it was in this spectrum which aminopenicillins cover. And aminopenicillins including Amoxicillin and Ampicillin. So let's look at the answer choices. We have Oxacillin, Ampicillin, Penicillin, tazobactam, Ticarcillin, and Nafcillin. Now, look at all of these guys here. Oxacillin, Ticarcillin, and Nafcillin are resistant ones, and they have a very narrow spectrums, and they're mostly used for skin infections. So we're going to cancel these out. This we said that is mostly for Pseudomonas infection, so we're only left with Ampicillin, which is an aminopenicillin, and within its spectrum is the treatment of Listeria. Question number 2. A 12-year-old boy presents with painful erythematous pustular rash on his face. Culture reveals β-lactamase producing Staph aureus. Which of the following is the most appropriate treatment? So here, again, we look at the symptoms of this patient. They presented with skin infection, and they have Staph aureus, and it's β-lactamase producing, meaning that for this bacteria, we need a Penicillinase-resistant penicillin. And we said that these include Ticarcillin, Oxacillin, and Nafcillin. But what I want you to remember is that we use Naf for Staph. And therefore, our answer here is Nafcillin. Alright, this is the end of our lecture. I hope you enjoyed it. I hope you learned something. If you like it, give this video a thumbs up. Let me know in the comments below what would you like to talk about in the next video.